We're with Carolyn today, and she's had some really great success with our care, doing some neurometabolic work with her. Carolyn, tell us about the symptoms that you had when you first came in.
Well, when I came to see Dr. Naylor, that I realized that something was not right in my body. I had been doing these iron foot baths before, but I thought, I know there's toxins in my body. I'm trying to eat well, but I knew that when I'd been diagnosed with diabetes, I thought, no, I can't be. And someone said, I think you have fibromyalgia. And I'm going, no, I don't think so. But Dr. Naylor offered a comprehensive questionnaire that I filled out, watched videos, and then talked to him on a basis after I had filled everything out. And lo and behold, yes, I do have some issues, but very calmly he explained that we can take care of this.
Yeah, and we looked at some blood tests from your medical doctor, and we also ran some additional blood tests to kind of fine-tune things for you. And I think you said that it really helped you understand what was going on as we went through those and explained them to you.
Exactly. In fact, Dr. Naylor suggested some blood work that my regular MD who I was seeing also for concerns about diabetes and weight loss, and they were willing to do the tests. I got the results back and took the copies over to Dr. Naylor's office. He gave me a much more detailed explanation of what actually was going on. My regular MD called and says, oh, you're low in B12, you're low in vitamin D, you need to get some more of that. And I'm going, what? So going to Dr. Naylor, very calmly explained, well, you're not really that low in vitamin B12, and here's the explanation of it. You do need vitamin D and several other things that I accept that my body needed something. And you know what? I feel so much better now, because before I was sleeping, excessive sleeping.
Yeah, how late would you sleep every day?
I would probably sleep. I mean, waking up before 9 o'clock was just not.
Yeah.
I just would not do that.
Yeah.
And sometimes sleep as late as 10:30, 11
Right.
o'clock. And I'm not that old, but I'm thinking, gee, today I feel so much better. I get up at 8:30 in the morning, and
Yeah.
I feel great.
And you've got energy.
I'm not tired. Now, there are some things that I eliminated from my diet, my program. But when you say diet, I'm thinking way of life.
That's right. And you also added some nutritional products so that we could sort of fine-tune things, and we tweaked how you're eating as we go along. We're kind of keeping a record of what you're eating so we can
Yes.
keep you on path.
And I have to tell you, people, this is the best thing that you could ever do for yourself, because as I began writing down, I kept a food diary. I got a little booklet that was easy for me to fill out, and Dr. Naylor provides little sheets to fill out all this information and turn in to him so he can analyze what you're eating and where you're going with it. But I said, I realized when I was write down what I'm eating and when I'm eating, sometimes I was going too long in between eating and my handwriting would be scratchy.
Mm-hmm.
I'm thinking, I have to eat more often.
That's right.
I need to be hydrated more often. I think, oh, I need to carry a bottle of water with me.
And you're not getting hungry, but how much weight have you lost?
I have lost right at 30 pounds just in a very short period of time. I would say, well, beginning in the program, actually writing everything down, I started in May, but the comprehensive program, this 12-week program that I signed up for, has just been September.
Yeah.
And so it's been an extreme. I feel so much better. This program that I'm on, I know I'm releasing toxins, so every teaspoon of toxins that's coming out of my body and teaspoons of fat that's gone, I don't need those.
That's right.
I think Dr. Naylor, most of all, has looked at me and he's complimented on, you look healthy. Now, wouldn't that be a great thing?
You've got a glow about
to
you, there's
hear
no doubt.
somebody say, you look healthy, or, oh, I like the way your hair is done, or I like that dress. No, you look healthy. Your whole entire body can be transformed if you listen.
And another big therapy that we've been using with you has been the PEMF, the pulsed electromagnetic field. You found that to be very comforting to you, haven't you?
Oh, yes. It's great. Walk in, lay back, and relax, and just let that it finds the places in your body that needs the work. I have some artificial joints, and whatever those are, the metal, if that's not good for me, I'm glad that the toxins can be removed in that manner.
And do you recall how much your blood sugar had changed?
Oh, absolutely.
Your hemoglobin A1C?
Back to being said I was diabetic. I started out 2 years ago finding out that I had one toke over the line, gone to 6.5 on the Richter scale, and I couldn't understand it. At my A1C, what? And it actually gradually went up to 7.7. When I saw Dr. Naylor, my A1C was 7.7. I was taking a lot of extra medication for my heart as well as for diabetes. Well, now both my regular MD and my cardiologist have cut a couple of my medications in half, and my A1C from 7.1 has gone down to 6.1.
Yeah, and they were very excited for you, weren't they?
Oh, absolutely. It's just an amazing thing to find that, wow, they're really happy at what I'm doing. And yeah, it's great to have your doctor be happy for you, but you have to be happy for you. So I appeal to you, if you want to start, if you're looking for answers, Dr. Naylor certainly has a team that is helpful and qualified. I feel so much better today, and I'm still losing weight. I feel like one day I'm not going to be called diabetic anymore, and that was the key.
We're going to win that.
When I first had my interview with him, that's what he said. We're going to eliminate these things. You do not have to be strapped to.
That's
one
right.
day you might have Alzheimer's.
That's right.
My mom had Alzheimer's, and I'm thinking, no, that's not for me.
Don't want to go there.
And I'm not.
We really appreciate you letting us care for you, and we appreciate what a great patient you are.
Thank you, Dr. Naylor.
Thanks for your help.